On today's agenda, it'll be breast cancer facts, screening guidelines, signs and symptoms, risk factors, barriers to care, and why women avoid mammograms. About ECU Health Cancer Care. The vision of the ECU Health Cancer Care System service line represents all aspects of prevention, early detection, treatment, research, and survivorship for persons with cancer, with multidisciplinary approach to comprehensive care across the purpose the purpose for ECU Health's cancer care. Our purpose is to become the primary provider of cancer care in Eastern North Carolina, reducing mortality and improving outcomes through continued development of sustainable national recognized integrated systems designed to provide ready access to prevention, early intervention, and quality coordinated patient care. What is breast cancer? Cancer is the term used to describe abnormal cells that occur in the body. Breast cancer starts in the breast, and if not discovered early, it can invade surrounding tissues and spread to other parts of the body. Types of breast tumors, we have benign, which is our non-cancerous tumors. We have malignant, which is cancer, and metastatic, spreading. Why recognize Breast Cancer Awareness Month? Support, educate, encourage, and fundraise. Sharing awareness through facts. Incidents. Breast cancer, most common diagnosed cancer among American women except for skin. Breast cancer is the second leading cause of death in women in NC. 1 out of 8 women have a lifetime risk of developing breast cancer. 1 out of 10 Hispanic/Latinos will be diagnosed in a lifetime. Sharing awareness through facts. Ethnicity. All women of all races and ethnicities need to be screened. African American women tend to get diagnosed later stage, thus 40% more likely to die from breast cancer. Median age for diagnosis of Black women is 60 years old. Breast cancer is leading cause of death in Hispanic women. Age. Median age of diagnosis is 62 years old. Median age for diagnosis of Black women is 60 years old. The younger a woman is diagnosed, the higher chance of reoccurrence. Male stats. Even though you're a male, you can still catch breast cancer, even though it is very rare. Lifetime risk of diagnosis is 1 in 726. Less than 1% of breast cancers occur in men. Black men have the highest incidence of breast cancer, and there is hope. Breast cancer deaths are slowly decreasing due to early detection screenings, mammograms, increased awareness, and better treatment. The U.S. 5-year survival rate for localized, meaning early stage breast cancer, is 99%. The U.S. 5-year survival rate for all types and stages of breast cancer is 91%. What are the risk factors now? Here at ECU Health, we have provided you with a risk factors, which we also have it in Spanish. Your risk, the main factors that influence your breast cancer risk are being a woman and getting older. Other risk factors include changes in breast cancer related genes, the BRCA1 or the BRCA2, having your first menstrual period before age 12, never giving birth, or being older when your first child is born, starting menopause after age 55, taking hormones to replace missing estrogen or proestrogen in menopause for more than 5 years, taking oral contraceptives, meaning birth control, a personal history of breast cancer, dense breast, or other breast problems, a family history of breast cancer, parent, sibling, or child, getting radiation therapy to the breast or chest, being overweight, especially after menopause. When should you get screened? Women ages 40 to 44 have the choice whether to get an early mammogram. Women ages 45 to 54 need yearly mammograms. Women age 55 plus may move to biannual mammograms and annual screening as long as they are in good health. Discuss with your provider about ceasing mammograms after age 75. If you feel a lump or any type of anything in your breast, you should get it checked no matter what age you're at, because we are seeing it sometimes in younger people, younger than 40 years old. What are the signs and symptoms? Breast, upper arm, or armpit lump, swelling, pain, or tenderness. We have nipple discharge, tenderness, or intervention. Skin irritations such as puckers, dimples, extra creasing, and scaling. Warm red rash that looks like an orange peel. Unevenness of breast, size, and shape. On the right side here of the screen, you'll see what those will take. How can I lower my risk? Keep your weight down, exercise, decrease alcohol intake, don't smoke, avoidance of estrogen therapy, get good sleep, and eat a healthy diet. Barriers to care, mental barriers, myths related to mammograms, financial and transportation barriers, free breast clinics, which Miss Jennifer will speak on that in just here in a minute, culture barriers, Spanish education material. Why are women avoiding mammograms? So I'm going to speak a little bit on why cancer is so important to me and why I chose this internship in the first place before I step onto the myths of mammograms. Back in 2013, my mother was actually diagnosed with colon cancer. Even though it is colon cancer and we are still in our breast cancer awareness month, every cancer is very important and should be celebrated every month and taken care of every month. But I am glad that we stick to months to celebrate each cancer awareness. Back in 2013, my family was very much hit with a hard rock because my mother was in her 40s. And I would say she was not 100% healthy, but I'd say at least 70% healthy. And right after that, she was diagnosed in August of 2013, and about a month later, I lost my father to a massive heart attack. So a lot of this stuff that I've been learning, even in the cancer center, still relates to a lot of the stuff that my father had and could lead up to maybe even potential stuff that could lead later on after his heart attack if he would have survived. So cancer has been very important to me. I still question every day, like, why me, why me? But, I've never been the type of person to blame it on any specific reason. Because I lost my mother about a year and a half later after my father, because her cancer started to spread other than her colon. So seeing a lot of this stuff is very relatable to what I've been through since 2013. I want to raise awareness to those people that didn't do early detection, because my mother really didn't do early detection, which I wish she would have. But colon cancer is probably the second worst cancer in the US to have, and breast cancer is very much up there with it. But I want to raise awareness so people like my mother will go get those early detections and be able to stop it at such a early stage. So I wanted to share that with y'all. Why are women avoiding mammograms? So we have, it hurts. True, it is uncomfortable, but having breast cancer hurts even worse. I'm afraid of the results. Yes, waiting is scary, but if cancer is found early enough, it can save your life. All of us get pap smears. Some of us, get our eyebrows plucked. The hurting of the eyebrows being plucked is probably, I feel like it'd be a little bit worse sometimes. But we can get that in early detection. So, getting those screenings really does help. And, we're afraid of the results. I mean, I'm 23 years old and I had my first pap smear back when I was 21, and I was literally shaking just waiting on the results, even though I knew nothing was wrong. Nobody in my family has had breast cancer. Well, I always relate back to this. Nobody in my family has ever had colon cancer. We've had some breast cancers in my family, but we've never had a colon cancer. So about 75% of breast cancers are found in women with no family history. I don't feel a lump. You don't have to feel a lump. Microcalcification only shows up on mammograms. I am too small to have cancer. Too small, too large, cancer never knows a size. I'm too young. Getting breast cancer before age 30 is rare. But if you have a lump, get it checked. Like I mentioned before in the previous slide, we are seeing it sometimes in younger people around my age. Self exams are very much and very much important at our age. And being able to check for those lumps, even if you don't feel one, it's always good to get one at your primary care doctor. Even if you don't know how to do it, always reach out to somebody that knows how to do it. Too much radiation. EPA states we get just as much radiation naturally in 6 months as we do with one mammogram. I've heard mammograms miss a lot of cancers. Not having one catches zero of cancers. My doctor has never ordered one for me. Ask your doctor to do so or schedule one for yourself. I feel as all of us have probably been in some type of situation where a doctor hasn't probably been, 100% with us or done their best. Um, it doesn't matter if your doctor has not ordered one. Go over that mountain and do it yourself, because your health matters. It doesn't matter what anybody else says or does. Step up for yourself and go get it scheduled, even if your doctor has never ordered one. I am healthy. Cancer does not discriminate between healthy and unhealthy people. I've known plenty of people that have been healthy their whole life and have gotten cancer, any type of cancer, no matter if you're unhealthy or healthy. Like it says there, cancer does not discriminate between healthy or unhealthy people. No matter if you're unhealthy, you're likely to get something, or if you're healthy, it's not going to change anything. But staying on a healthy diet does help a lot of things. All right, and I'm going to pass it over to Miss Jennifer now.
All right. Thank you, Madison, and thank you for sharing your story. Madison is wise beyond her years, and she has experienced her life experiences at such an early age have really helped form the young lady she is. And I'm really proud of her and how she's using her story to help spread the message of the power of early detection. So I appreciate her sharing that with us today. And, many times those stories are what really connects with our hearts and helps us make changes in our own health. So yes, I'm going to share a little bit about our ECU Health Cancer Care and what we do specifically during Breast Cancer Awareness Month. This picture that you see was just taken a couple weeks ago, and that is a lot of our team here. This was on Wear Pink Day, and we do that every year. It's usually the last Friday of the month, but we moved it. So we'll talk more about that earlier, but we moved it to kind of correlate with one of our retreats that we have here at the Cancer Center. But on the back row, well, on the front and back row, you'll see our ECU women's basketball team, and then some of our radiation oncology team, a couple doctors, our administrator, radiation therapist. So just a great group. We had a fun morning in October earlier this month. Okay, so awareness and education, meetings like this one, partnerships throughout Pitt County and Eastern North Carolina are what increase knowledge through sharing of the power of early detection. And we do that in October as hard as we can. We really try to get that message out and really encourage community members to assess their risk factors every year, because they change every year. Family members get sick, our health changes, our weight changes, our habits change. So we really want to take that time during the month of October to, when did I have a mammogram? Months fly by, days, weeks, months, and then you realize, oh my gosh, I've not had one in 2 years. So really just stop and taking time in meetings such as this to assess what my risk factors are today. So So one of our partnerships that we're really proud of is we have a great partnership with ECU Athletics, and during the month of October and in February, we're able to connect with a couple teams. ECU Volleyball for the last couple years has been reaching out and asking us to be special guests at their Dig Pink match, which was held this month on October 5th. And they extend a special invitation to ECU Health Cancer Care, as well as survivors and those that are still in the fight with breast cancer. So we've gone for the last 2 years. You'll see a picture here with some of our outreach team members that are out in the region. We really are intentional. We have a bi-monthly cancer screening and work group where we bring together different team members for ECU Health we have a total of 9 hospitals, but here a total of 9. We have, of course, what we consider somewhat the flagship here at ECU Health Medical Center. And then we have the 8 hospitals out in the region. We all meet regularly to discuss our cancer screening outreach initiatives, and we try to come together as much as we can. And it's at events like this that we're able to join up together and see each other more than just on a Zoom screen. So that was a great day. We typically set up and share outreach education. You'll see on that bottom left picture, Madison and I sharing information with spectators. So that's a real great partnership that we have with the volleyball team. Next slide. So as I was saying earlier, we have Wear Pink Day, and for the last 4 years since I've been here, the ECU women's basketball team has come on campus at the Cancer Center and greeted our patients and our visitors and our team members, passing out pink ribbons and promoting their pink game, which is every year in February. They have a special game for breast cancer awareness. This year it'll be February the 21st, but I'm not sure who they're playing, but they do a special game and they invite caregivers, survivors, those that are still fighting, and you'll see a lot of the ECU Health Cancer Care team members there. So we're really proud of that partnership. In the top right box, you'll see our service line administrator, Phyllis D'Antonio, and then beside her is Coach Kim McNeil, who is the fearless leader of the Lady Pirates, and then our marketing manager, Tom Stanley. And then you'll see the girls, some of the girls here as they were passing out their flyers for the pink game and the ribbon. So we really enjoy having them, and just the excitement that they bring the morning that they come and spend with us here during Wear Pink Day. So we share awareness through education. This is just an example of our education. This is our education table for the month of October that Maddie created for us. And we really do value the partnership that we have with East Carolina University. And, every year I get lots of requests for internships, and typically I only get 2 each year. I usually get them in the spring, but I've decided to get 1 in the fall and 1 in the spring. But that partnership is very near and dear to help these students flex their public health muscles and give them that experience to be able to share in person and virtually the power of early detection. So we're able to give information not only here, of course, in the Cancer Center, but we give information to churches, ladies groups, various breast cancer awareness month events. We get lots of requests to go out and speak. And if we can't speak, we do try to give them educational material that they can use at their events. So as you see here, the quote, that's from ECU Health Cancer Care, that's on our site. And I say it all the time: early detection, early treatment can make a tremendous difference in the life and the lives of those you love. But, we say it, we don't want to find cancer. It's not our goal to find cancer. But if we do find it, we want to find it in its earliest stages, when it's most treatable, when the outcomes are better, when it's less of an upheaval for you and your family. We want it to be a bump in the, no more than a bump in the road. We don't want it to be the end of the road. So we're really seeing, as Maddie stated earlier in her presentation, that through early detection, 3D mammography, improved treatments, and through awareness events and through education such as this meeting, we're able to have a positive effect, and we're seeing better survival rates for breast cancer. Some of the opportunities that we've had to speak, we can't go to all the events, but we go to as many as we can. And this was one event that was held on October 11th. I wasn't able to attend this event, but Dr. Chambers, who you'll see in the picture on the far right, on the right, in the long pink dress, she is our surgical breast our breast surgeon here. She's the lead of our breast program. She's actually delightful. Some of you may have met Dr. Chambers, but she was able to come and share. This was an event that took place in Martin County. It was hosted by Nakima Gilliam. She is a breast cancer survivor. And many of our events that we get requested to take part in are hosted by survivors. And I love that. They're somewhat ambassadors for this message. And I love that they have this heart to provide these events to the women in their community. So this was a wonderful event. I spoke with Dr. Chambers, and she said about 50 women attended this event in Martin County. Next, Maddie and I had the honor to attend the Hope and Healing Breast Cancer Domestic Violence Awareness event last Saturday. So this took place in Wilson, and this was also hosted by a survivor. Her name was Sonia Carr. She is a breast cancer survivor, and then she partnered with a domestic violence survivor. This month is also Domestic Violence Awareness Month. So she had a survivor at her event that shared just a powerful story of her experience, and how she spoke up and she wasn't silent, and she's been able to take her story and share it with other women. It's just amazing, amazing story. I can't remember her name. I wish Latoya. Her name was Latoya. Maddie, do you remember her name?
Yes, because I wrote it down to look it up and contact her.
Yeah.
LaTanya Allen.
LaTanya Allen. Write that name down and Google her
Yes.
story. If you do, you'll see it.
It might be under another last name, just because she is recently married. Her husband's actually in this picture at the bottom right.
Yeah.
Somewhere. But yeah, I'm pretty sure it's under another name, but it wasn't hard for me to find it at all.
Yeah, because afterwards we were both, we need to look that up, because that was just a very powerful story.
Very.
And then they just really dovetailed that with Breast Cancer Awareness Month, and just the stress of domestic violence and what that can do to you emotionally and physically. And then, of course, they had a breast cancer survivor speak at the event as well. But that was just an amazing event. We were really honored and really blessed to be a part of that. And then we left that event, and we drove to Canada, and took part. This will be the third year that we have been a part of the 50 Shades of Pink. That was hosted by Selena Hines, and every year she sells tickets to this event, but the proceeds go to a local breast cancer patient. So she surprises a person at each. She has somebody that she's got in mind. She has them come to the event, and at the end of her event, she has a special moment to award them some financial help as they fight breast cancer. They usually have their family. It was a sweet event, and we're always excited to be a part. And glad that it worked out that Maddie and I could be there to share about risk factors and mammography myths. So that was a great event. And then and then Dr. Chamber. We really do try to have a media presence when we're asked to go. We um, try to speak as much as we can about the importance of breast cancer awareness, and that's Dr. Chambers. She spoke last week on WNCT. And then let's see what I think next is today. Today, I'm always happy to be partners with a Mexican and share whenever they ask us. And then we're going to be with them tomorrow at the 5K. And I'm not going to steal Jennifer's thunder here. I'm sure she's going to talk about that. So we're excited to be there tomorrow and be part of that. But really what we're excited about is our access to care initiative. So Matt, you can scoot to the next slide. We really are proud of our breast cancer screening clinics here at the medical center. We have this year we will have hosted 15 free breast clinics. We do it monthly, but we are able to do it we pick 3 months of the year to add an additional clinic because the volume is so great. This is just a few of our team members. That's Laura, she's our mammography technician, and Courtney, she's our ultrasound technician, and Miss Dee Dee, who is our delightful assistant here in the imaging clinic. So each month we do free mammograms for women that live in Pitt County that are 40 and older that haven't had a mammogram in a year or more. These women do not have health insurance and they are of low income. So in order to be a part of this clinic, you have to register. That's my number on the flyer on the right. This is our Spanish flyer, of course, but you'll see that when you call over, we make sure that you're qualified for this and for this clinic. And a lot of our patients, we have a lot of Hispanic patients, and just this month, you can scoot to the next slide, just this month. So we did 2 clinics in October, and we did 2 clinics. We try to do 2 in February, in July, and October. And out of the last this month we did 20. We did our last clinic on Tuesday. Out of the 20 free mammograms that we provided in October, 17 of those were Hispanic ladies. So very proud of that. And as Maddie mentioned earlier, we do have 2 what we call them rack cards. They fit in a rack, but you can put them anywhere you want to put them. But we have 2 cards. One is what you need to know about breast cancer, and then one is entitled Better Care Close to Home. And so this one that you see in front of you is the Better Care Close to Home, and it has the importance of 3D mammography and getting that mammogram yearly after the age of 40. And then you'll see all of the 11 3D mammography sites that are available here at ECU Health throughout the 29 county service area. So if you need any of those, I have lots. I have lots of the Spanish version. I can get those to you. Just send me an email, put it in the chat. I'm happy to send those out to you to disperse in your circles of influence. The next slide shows what you need to know about breast cancer. So Maddie earlier, she shared the front of that slide, which was the risk factors. And then on the back, you'll see signs and symptoms, and she went over those as well. So that's, a front and back. Both those cards are front and back. And again, we have many of those in Spanish. So happy to share. Just let me know. And then this is just new, just a little bit of new information. That rack card that you see on the right, that's one that we just created. Marketing just created that, and we've not really started sharing that, but I've got some that I can share, and that just outlines the comprehensive breast care that ECU Health has, starting from prevention and early detection throughout diagnosis, treatment, survivorship, and then second opinions are available for those that would like a second opinion here. Ashley Quinn, Dr. Ashley Quinn she has just joined ECU Health. She is a surgical oncologist, just like Dr. Chambers, who you saw in earlier slides, where she joined us in September. I got the opportunity to meet her last week. Just super nice lady. She did her, she attended medical school here in Greenville and did her fellowship, I believe, in Texas, and now she's back. So we always like it when that happens. So we're really excited about her being on board and just being able to care for even more of Eastern North Carolina. And if you, I hope you enjoyed our presentation. If you have any questions, don't hesitate. I'm happy to answer what I can.
Thank you so much, Jennifer. I did have a question. So how can we encourage like conversations about this, especially in communities that this could be like a very taboo subject? I noticed that that is something as well within the Latino community. It's very hard to talk about this.
Right. So when I took this role, it became very apparent that most women know that at the age of 40 they need to get a mammogram. And unless you're living under a rock, 40's that year that we need to do that. So that's one reason that we created the part in our presentation about myths related to mammography, because we know people typically know they need to get a mammogram, but there's a reason that they're not getting those mammograms, and some of them are cultural, and some of them are just as simple as, like Maddie said, it hurts, or they're scared of the results, or some people feel like breast cancer is a curse. It's something that they've done to themselves. And we're here to debunk those myths. Some people just don't feel like they can afford it, so we really tried to make it free. We do these here at the medical center, but this isn't the only place in Eastern North Carolina you can give them. Many of those other hospitals that I told you, the ECU Health hospitals, provide free mammograms. The health departments, most health departments participate in the BSEP program, which also provides free breast and cervical cancer screening. I think what you're doing here, Jennifer, having these conversations is most helpful, just getting that conversation started. I would say out of 150 mammograms that we're doing here at the medical center during our free clinic, I would say 90% of those are Hispanic ladies, and many of them were trying to pass out flyers to let them share with their loved ones, their sisters and their nieces and granddaughters and daughters, to share this information. And we have gotten a lot of referrals because of loved ones sharing. So Maddie said earlier, if your doctor hasn't ordered a mammogram for you, call for yourself. At the age of 40, you do not need a doctor's order for a mammogram. You can self-refer. Women can call ECU Health scheduling and say, I'm 41 years old, I need a mammogram. You do not have to have a doctor's order for a mammogram. If you are having lumps, or if you've got any symptoms, you do need to reach out to a primary care provider. The Bernstein Clinic is a great provider here. It's a federally qualified health center. We get a lot of referrals from them for patients that don't have insurance. So if you do have an issue, we encourage you to have it looked at immediately. We don't want you to wait. If you say you had a mammogram last month and then this month you already feel a lump, don't wait until next year to have your mammogram. Go immediately and have it checked out. So, but yeah, just conversations like this, just real conversations, and word of mouth. I think that's what does it. Helps. Doesn't do it, but it helps.
Thank you. And then I did notice like the events that you've been attending, you go outside of Greenville, like Wilson, and other surrounding counties. I noticed that the for the free mammograms, it says like Pitt County residents. Are there any other clinics like for those that are outside of Pitt County that they can attend to that ECU Cancer Center is aware about?
Yes. So ECU Health Beaufort, which is in Washington, they do free mammograms bi-monthly. So if I get referrals from Washington or Martin County, I typically send those to Kelly, who is their community health improvement coordinator. The health departments, Wilson, if I get a patient from Wilson, we try to connect them with the Wilson County Health Department's VSEP program. So if someone calls me and they don't live in Pitt County, I don't just say, sorry, we can't have intentional about getting them connected with someone that can do these mammograms free. Lenoir County Health Department, if we get a call from Kinston, Edgecombe County, ECU Health Edgecombe and Tarboro, they are in the planning phases, and hopefully in November they will start offering free mammograms to patients. I think they're going to try to open up 2 slots each week for patients in their imaging clinic. So there's lots going on. Jennifer, you have my contact information. Always happy to help make those connections for our patients.
Sounds good. Thank you. And I did just want to mention one thing. Like my mom, she was able to get a free mammogram earlier this year at ECU Cancer Care, and it was very easy process. They even had somebody speaking in Spanish, like to help communicate with her. And I think the only thing that I did was made the appointment for her and tell her where to go, but everything was taken care of, especially with the language barrier.
Great. I'm glad she had a good experience. We enjoy. That's probably the most, our interns, and Maddie can probably speak better to this, but typically throughout the internships that I've had, the interns, they love the free mammogram program. They love that. And I'll say that those free mammograms are funded through the ECU Health Foundation, and it's because of donors, generous donors that donate to ECU Health Cancer Care, that we're able to provide free mammograms. So through that program, we're able to do free screening mammograms. If a patient has a suspicious finding, like say something shows up on their mammogram that's of concern, the radiologist may want to do then a diagnostic mammogram, which is more films. Is the difference is it's more images. So our program will pay for a diagnostic mammogram if that's what the radiologist feels like needs to happen next. If there is something, if even more suspicion, even after a diagnostic mammogram, typically the next step would be an ultrasound. Our program will pay for an ultrasound as well. After the ultrasound, if the radiologist feels like now there's a biopsy that's needed, that's when we will connect our patients with the Pitt County Health Department or whatever health departments in their area. We'll connect them with the health department to get approved, hopefully, for BSEP funding. BSEP is a state-funded program. BSEP is an acronym for the Breast and Cervical Cancer Control Program of North Carolina. So they have BSEP Medicaid, and they're able to help women, all women, Hispanic women as well. They're able to help them navigate that journey of, is this cancer? Is this not cancer? So we have a great relationship with the Pitt County Health Department, and we will send them patients every now and then that need a biopsy that have been a part of our clinic. And then they will help that patient, because we don't want our patients to leave us and then, they're, oh gosh, now I've got to have this biopsy. How am I going to pay for that? So we really do try to have that continuity of care to help bridge that, so they're able to to go somewhere where they're supported financially and through their health care as well.
Thank you. And then we did have a question. So are any of the federal cuts going to be affecting the free services?
Our program, no, our program will still exist. We will still be doing free mammograms. Ours is not based on the government. Our program is funded through those generous donations, and they are paid for through ECU Health. So no, this will not be going anywhere. I'm not really sure. I know that Medicaid expansion is taking a hit, so I'm not. If anything, I feel like our clinic will be even more full. So.
Sounds good. Thank you. Anybody else have any more questions before we move on? If not, thank you so much, Jennifer and Madison, for this presentation. It was very informative, and we're always excited to have this every year during this month. Thank you, Jennifer, for being able to be a part of these meetings that we have for Breast Cancer Awareness Month.
It's my pleasure. Thank you for always. I was wondering this year if we were going to get an invite, and it was almost like as soon as I was thinking last week, I was like, I haven't heard from a Mexican, and it was the very next day I got a message. So, always happy to be here and share, and really excited about tomorrow,
Yes.
being with you guys.
Yes, that's another thing that I want to mention for everyone up here on the call. I was going to share my screen, but tomorrow we're going to be having a 5K that our interns are planning. So the goal is to, advocate for breast cancer awareness. It's going to be at River Park North. So if you're interested, come out and join us. So we're very excited to have also Jennifer and Madison be a part of that event to have a research table out there. And then another two meetings that I did want to mention. This Saturday we're going to have a natural disaster workshop for the Latino community to be more informed about, how to prepare for a natural disaster. It's going to be at the Ag Center this Saturday from 9:30 to 1 p.m. And then next weekend, Saturday, we're going to have the ENC Latino Youth Conference. This is more education for high schoolers that are interested to be more involved in higher education. We're going to be talking about FAFSA, resume building, scholarships, and civic engagement. So we're inviting high schoolers and also some college students that want to go maybe to a university or anything to join us that day as well. So we will be also sharing this information in our newsletters and social media as well. But if there are any more questions, thank you again, Jennifer and Madison, for joining us and everyone joining us today. And we hope you enjoy the rest of your days.
Thank you, Jennifer. Thank you, everyone. Thank you, Maddie.
Thank you.
Thank you.